Hi, I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District, and vaccines seem to be taking over the conversation. But before we get into that, as of right now, where are we with the cases and recovered and hospitalizations? What do our numbers look like?
Okay, right now, as of this morning, we have 721 active cases in isolation. We have 1,006 individuals in quarantine. We have 28 Champaign County residents that are hospitalized, and we have had 101 deaths. Our region's positivity rate right now is 7%, and in Champaign County, it is 6.2%. So, the mitigation has certainly helped Illinois. If you look at a comparative map from before mitigation to now, it definitely works. So it may be that, we're on our way to opening some things back up.
We'll get to those questions in a second about what and when things are opening up. But first, vaccines seem to be the million-dollar question. This week, you're working on 65 years old and older with pre-existing conditions. Where are they happening, and how do people get signed up for these?
So we had about, it was over 4,000 vaccine spots. They filled up in about 6 hours. So if somebody has a vaccine slot this week, they'll know where to get them. It'll either be at the iHotel Community Vaccination Clinic or at the Dress Barn Community Vaccination Clinic, or some people may have, if they had missed their previous appointment due to, or not their previous appointment, but if they had missed their previous category, like let's say they're 75 and up, they may end up coming to CU Public Health District. So we have several places where people are getting vaccinated. And the good thing about it is that they call into our number 239-7877 or go in through the link that they receive, and they can sign up for those appointments. So we're still doing this week 75 and up because we had vaccine last week. So we're going to finish that up. Then 65 and up with underlying health conditions. And then we're going to keep doing those until we get everybody in that category. Then 65 and up. And then we're going to do all of the school staff, teachers, everyone associated with the schools, bus drivers, everyone. So
that answers my next question, is who's the next group after the 65 and up with underlying conditions? It's schools, teachers, staff.
Yep. Well, after 65 and up, yes. So we've got 65 and up with underlying health conditions. Those are being prioritized over 65 and up with no health conditions. And then, we just are going to keep moving through the different categories until we get every single person in this community who wants vaccinated.
Have you noticed any adverse reactions to the vaccine?
No, knock wood, we have not. But I do want to let people know what it's like when you come to the facility or to the mass vaccination clinic to get vaccinated, so that people aren't anxious about it, because it is a new vaccine, and that makes some people anxious. So when you come in, you will have your paperwork, or you'll fill out your paperwork there. You'll go right over to one of the vaccinators. You'll get your shot. They'll answer any questions you have. If you're concerned because you have an allergy or something like that, you can ask a doctor to come over and answer any questions for you. And then everyone will go over and sit in an area, socially distanced and masked. They'll sit in an area where they will be watched by paramedics who pretty much just patrol up and down the whole time. If anyone is particularly anxious and they're concerned that they might have a reaction for whatever reason, we can actually have someone stand right there with them and watch them their whole 15 minutes until they're done. Should someone have a reaction, we have, like I said, we have paramedics there. They have all of their equipment there. They have a little, 2 little rooms kind of right there in the clinic, set up to assist anyone who should need it. So we have, lots and lots of staff there, keeping an eye on everyone. These are really big community-based clinics. So it's not just CUPHD staff there, it's CUPHD staff, it's Illinois Fire Institute, paramedics and staff. It is Carl and Christy and Francis Nelson and pretty much everyone, OSF. So everyone has vaccinators at the different clinics.
And if somebody hasn't been out of their house much since last March and they're really nervous about going indoors, from what I've seen from the pictures, chairs are very spread out. Everybody is masked up. Can you reassure people about the safetiness of that room?
Yes, it is both of the spaces are very large. The I Hotel, where public health is throughout the day, it is very, very spread out. Everyone is wearing masks. And in fact, you're not even allowed in without a mask. If you don't have a mask for some reason, we can offer you one right there as you walk in. Everyone will be screened and have their temperature taken on their way in. And they're usually in and out of there in less than 20 minutes. So they're not, and when they are sitting very far apart. So all the feedback that we've got so far is that they were very, very comfortable with that. Because you're right, there are people who have been doing exactly everything perfectly to protect themselves. So, they don't want to risk going in someplace where they might be crowded. That's why we're doing the appointment-based system in Champaign County, because we do not want any crowding, any people waiting outside or waiting in line or anything like that. There's no waiting. It's all appointment-based. So you just come in, you do your little rotation, and you're out. And then more people are coming in as you're leaving. So
you mentioned Champaign County. Do you have to be a resident of this county in order to be part of this clinic?
Yes, you do. So people are supposed to be getting vaccinated in the counties where they reside. Now, if they work in this county, let's say they work at Carl, and Carl was vaccinating all healthcare workers, you can get vaccinated where you're employed. So it's one or the other. But yeah, it's usually where you live is where you are to be vaccinated. Like I said, the only thing would be is if it's a work-related situation.
I understand that some of the shots are 21 days apart. Some of them are 28 days apart. Let's say I just got my second shot yesterday. How long am I immunized? Is it apparent? Do we know these answers yet?
We don't know. Well, I assume what you mean is how long will your immunity last after you get vaccinated? So how long will you have immunity and be protected? We honestly don't know yet. So they're still looking at the initial people that were in the trials and following them to see, how long immunity lasts. And the science is just going to continue, following along and catching up, but we don't know yet.
CVS and Walgreens have been charged with getting the vaccine to nursing homes and long-term care facilities, but that's still slow going. And a lot of people are quick to blame the drugstores. Could that be the fact that we don't have a national stockpile like we thought we did, and that we're slow getting the vaccines in our hands?
It could be a number of reasons, yes. But one of the things is, which we weren't really 100% sure why they charged the pharmacies with vaccinating all the long-term care facilities to begin with. But was a federal decision. But yeah, I think that part of it is just, they only have so many staff, and in Champaign County, there are a lot of long-term care facilities. Some counties, there just aren't that many. So it has to do, it has to do with all those different variables. How many people are in these facilities? How many vaccinators do these pharmacies have? Because most of them had to hire people in because they don't keep, anyone who's been to a pharmacy knows that it's just not teeming with lots of employees in general. That's just not typical of how they operate.
It could be staffing then, you're saying. Let's not be quick to blame the...
Yeah, it could be any number of things. And like, again, with Champaign County, we have a lot of long-term care facilities in our county, whereas some counties may only have a few. So it would be easier to, get through those. But
let's focus on the good news that you mentioned a minute ago, that we're trending in the right direction. Our area is Champaign County, I believe you said, was somewhere between 6 and 7%. For some people, that means that they are really excited to get back in and sit in a restaurant for in-person dining. What has to happen in order for that part to happen?
Well, we need to go back to tier 1. So we're right now in phase 3 mitigation. Our numbers are definitely headed in the right direction. In fact, the thing that was holding us back were the number of hospitalizations. So I do want to remind people that even when we're out of the mitigation into the less restrictive, That does not mean things have changed in the sense that it's safer to do certain things. So you need to really consider before you go into a place where you could be exposed, you really need to consider, am I at high risk? Do I hang around with or have interactions with people who are high risk? Because it is not, because like I said, it's not that it's safer. It's just that we have hospital capacity now. So it's important to keep doing the things that you need to do to stay safe, which is masking, distancing, hand washing, things like that.
So this community did a good job of not congregating for Christmas and New Year's based on our numbers. Is that correct?
Yes, compared to some other places, I would say yes, that is definitely true. Especially at Thanksgiving, we noticed that the numbers, travel numbers, I haven't gotten the travel numbers yet for the Christmas holiday, but you know, we did know we were going to see a surge with Christmas and the winter holidays, but we did see that. But what we're seeing right now are the hospitalizations and deaths associated with that. And again, that comes a while later, and we knew we would, and unfortunately we are seeing that.
If I may be the bearer of more good news, Johnson & Johnson has now announced that their study has 95% effectiveness. Does it really matter, Moderna, Pfizer, Johnson & Johnson, what goes in your arm?
No, as you know, we're in the middle of the pandemic, so we're lucky that we are in a position to start seeing a lot more vaccinations, get through the trials. So, you know, you get the first vaccine that you have access to as soon as you have access to it. That is a suggestion.
Do you coordinate with the other public health departments in our area? Champaign's doing really well, but some of them, their numbers are higher than I'd like. They have buffets open and they're not handling things like we are. How closely do you coordinate with other counties?
Well, I mean, we all are under the same type of guidance. The state is using public health guidance. So when you hear the governor talk about the different tiers and things like that, those are public health measures. So we're all under them. The difference between our county and other counties is that we have support here. We have a lot of support, and we've been, you know, pretty much doing, the vast majority of places have been doing a great job in our county. A lot of places don't have it. The health departments do not have support. The mitigation, you know, in a lot of places they're being undermined. So that's going to end up with more cases, and that's going to end up with more hospitalizations and more deaths, and basically more problems. So it's not like we coordinate with each other, but we all know, you know, we talk a lot. We know what we're doing, and we share best practices. If we have something that's working real well, we share with them. But not all health departments can do some of the stuff that we're doing in our county for a variety of reasons. I mean, we're a large health department. We have a ton of community partners, and that just isn't the case everywhere, unfortunately.
My last question mirrored my first question. How do I find out when and where that I personally get vaccinated?
So every week, at least at the beginning of the week, we're going to put out a press release saying, or it might be every 2 weeks, depending on how long it takes us to get through. But we'll always say when we're moving through a new category. So, you know, right now, this week we're saying 65 and older. As soon as we opened that, we had just a flood of calls. And if you can't get through, leave a message and we'll call you back. And then you will get an appointment, or you'll get put on the waiting list. And then when we get more vaccine, we will call you or email you and get you on the list for a vaccine. So the best thing to do is go to the CUPHD website. We have the data dashboard up there. You can look at, you know, our numbers, and then below that is vaccination, and you can read the state's plan. You can read where we are. You can see how many vaccines we've given first dose, how many vaccines we've given second dose. You know, we put lots and lots of data out on our website for people who like that sort of thing, and we do have a lot of people in our community who like that sort of thing. So that's good.
And your website is very user friendly for anybody that goes on there and wants statistics. It's laid out in a way that those of us who aren't great at numbers can understand.
The person who does that for us is absolutely amazing. She just does a fabulous job with it and changes it. And if you want more information on it, where it says Tableau at the bottom of the graphics. You can click on that, scroll all the way down to the bottom, and you'll see there's a bunch more type of databases that you can look at, including locations where outbreaks have occurred, where cases have occurred, deaths broken down by various things. So it's a very useful website, and she's a good one to have on board.
Speaking of good ones to have on board, could I segue into our producer, Jason Liggett? He's pretty amazing. He does what he can to make us look good during a pandemic. I know it's a lot of effort, but thank you, Jason. Thank you, UPTV, for letting Julie and me continue to do this week after week. Urbana Mayor Diane Marlin, we wouldn't be able to do this without your partnership. Julie, Pryde, I am happy that we get to do this together, but I will also be happy when these are over. Administrator of the Champaign-Urbana Public Health District, thank you for all your hard work.
Thank you. Stay safe.